Good afternoon and welcome to another episode of Afternoons with Anthony. I'm your host, Anthony Savage. Today we are joined by Dr. Babiuch from the Cleveland Clinic here in beautiful Wellington, Ohio. Dr. Babiuch, thanks for coming on the show today. I'm looking forward to our conversation. I know Cleveland Clinic has so much to offer here in the community. I know that you guys also have a whole hospital network that's working very hard to combat this pandemic we're facing. I want to thank you so much and thank the clinic for all the hard work that you guys do right now. And also, I want to start out today by thanking all of our viewers and all of those in our community that work together to bring about a better future for us all. And as I say every episode, you guys are all amazing here in the community. Thank you so much for all you do. Keep fighting the good fight, everyone. Better days are ahead. And now, before we really get started, I want to remind our viewers to like, share, and subscribe to the channel. It does help us to keep you informed about all upcoming events and important news that affect our community. Your support really helps us reach more viewers like you. And again, Dr. Babiuch, thanks so much for being with us today and welcome to the show. How are you doing?
I'm doing very well. Thank you for the opportunity. Happy to talk to you and the Wellington community about what we're going through at this time with the COVID pandemic, as well as, medical care and questions in general.
Awesome. Can you give me a little bit of a background as to how you got involved with Wellington and the Cleveland Clinic?
Yeah, so I've been at the Cleveland Clinic now for almost 10 years, 10 years this September, and started off practicing in the Lorraine Family Health Center up on Cooper Foster Road. When Wellington became a target for the Cleveland Clinic to bring a practice to, I started right up practice open. So have been here since the beginning and practice here one day a week, in addition to a few other doctors and nurse practitioners that we have at this office, as well as our eye doctors here as well. So, certainly it's been a rewarding experience to be down here and serving this community and delivering care, and have made a lot of fantastic relationships with individuals here.
Without a doubt. And thank you for being part of the community here. Can you tell us a little bit about the COVID-19 response that Cleveland Clinic's been taking during this pandemic?
Sure. So as everyone knows, the COVID pandemic hit in March, and given that this is a condition that we don't really know anything about or didn't then, it's brand new. There was a lot of unknowns that came with this.
Right.
We had seen what happened in China and Italy at that time, in which large number of people were infected and many people were dying. So I think the Cleveland Clinic and Northeast Ohio really did a fantastic job in preparing for what could have been the worst case scenario. The Cleveland Clinic, really took the lead in preparing our hospitals, our caregivers, and the community if there was a huge surge of patients that would be, nearly overwhelming to the healthcare system. We trained, all of our outpatient providers to be able to do inpatient care. We figured out how we could expand the number of hospital beds, the number of ICU beds, ventilators, and things very significantly to be able to take care of a large population of people if that's what happened. So I think, the Cleveland Clinic really put a lot of resources in thinking about how we could respond to the pandemic. And it really has been nice that we haven't had to in that way, because we didn't have a huge surge of patients that had COVID and were hospitalized, like areas like New York. But we have done a lot of other things to really prepare and take care of people that don't have COVID during this time. We've put together a home monitoring program for those people that do have COVID to help to keep them well at home. Also put together outreach programs for people with chronic disease to try and take care of those chronic diseases at home while, we weren't doing as many face-to-face visits. And then lastly, there's been a lot of communication from the clinic out to our communities as to how to deal with COVID-19 and all the changes to society and healthcare that have come to be able to cope with those things. So I think our approach has been really, significantly positive. in preparing for things that fortunately didn't hit, but also, trying to take care of people during this time and their regular issues.
Without a doubt, it definitely shows the agility of Cleveland Clinic as a whole, being able to, quickly prepare for a more worst case scenario. And thankfully, we haven't needed that. So that's been a blessing right there.
Sure.
Yeah. Now, how is Cleveland Clinic making it safe to receive care during this time?
Yeah, so we've spent a lot of time in thinking about that. We know that, we need people to be coming back to our buildings. We need people to be having necessary and even elective procedures, and have really put a lot of time and effort in determining how to best do that. So all of our locations have, policies and procedures in place to keep it as safe as possible. That ranges from, screening all of our healthcare workers, checking temperatures when we come into work in the day, wearing masks, training on social distancing, cleaning and disinfecting, hand washing for all of our employees. And if an employee is not feeling well, we investigate, determine what to do, determine if there is COVID or not, and go from there. As far as patients coming into our buildings, we do temperature screening. We do questionnaires to identify symptoms of possible COVID-19 to be able to not have those patients come into our buildings, assess them by either a virtual means like this or telephonically, and decide what we need to do, because we absolutely still have to take care of them, but we also don't want them coming in and exposing others and our caregivers. We've also changed, visitation policies, as I'm sure everyone has heard. There's, limitations in terms of visitors that can come into the hospital, as well as outpatient, facilities, so that we decrease, that risk as well. And then we're constantly evaluating and determining if those are the right things, and, improving things as we go. So this is a ever-changing situation, and these are the things that we're doing to make things safe. I should mention also masks. So we have found that that's a really significant, part of the plan to decrease the spread of COVID. And we're asking, that all of our patients, respect that and come in wearing masks. If they don't have one, we will give them a mask, and all of our caregivers will be doing the same.
Okay, that makes sense. Now, with deferred care becoming a hot topic, so to speak, can you talk about the dangers of waiting to get the medical treatment you need?
Yeah, so deferred care is really a significant concern, and in particular for me as a primary care doctor, my role in healthcare is prevention of disease, as much as it is in finding and treating diseases that are already there. So deferred care is definitely something that that we want to avoid. So deferred care really means not going to the doctor or not seeking medical attention for an issue that you're having because you don't want to be exposed to COVID-19, or there's concerns about, going to see your doctor, going to the emergency room or the hospital. And in some cases, deferred care is okay. Let's say you're having a screening test for colon cancer. You don't have cancer. This is a test to go and look for it. And postponing that a few months because that's elective is not bad. But if you're having chest pain or stroke symptoms or severe abdominal pain, those are things that really can't wait. So you would really need to have that addressed. The other things that people don't realize is deferred care is managing those chronic medical conditions like diabetes, like hypertension or high blood pressure. Those things still need to be controlled in the time of a pandemic. So would need to be working with your healthcare provider to identify, if those things are getting out of control by testing at home. And now, certainly coming back into, the doctor now that it is safer to do that.
Yeah.
So those are the things that we're looking at. So really, I think, the take home point here is keep an eye on how you're feeling, keep an eye on your symptoms and don't ignore them because we're in this pandemic. Your physicians are always available to you by phone, virtually. And, if it's needed, we're there in the emergency rooms doing things to keep you safe if you're coming in.
Awesome. So all of our viewers, if you need help, get the help you need. Don't wait.
That's well said. And also, I would say, do the things that you need to do to keep yourself safe at home and healthy at home.
Without a doubt. So along the lines of, how you guys are requiring masks and social distancing, and we're trying to follow those things. But in your perspective, what does returning to work look like for businesses in the area? What are the things that they're going to need to do, now and going forward as this continues?
Yeah, so this is obviously an ever-changing thing. So what I say in today here will probably change in 3 or 4 days, and that's a good thing, because that means that we're able to watch where we're at in the pandemic and make adjustments and always learn. So I think, first and foremost, those businesses that are opening, should be paying attention to, the recommendations from the Ohio Department of Health, the governor and things like that. But also listening to, themselves and their customers as, how can they make things as safe as possible? I think we've seen, restaurants doing, carry out, changing their physical layout of their spaces, having outside seating. We've seen retailers doing, drive up, pick up, groceries, Best Buy, doing curbside delivery and those things. And, certainly other businesses that do things differently are modifying things as well. So I would say the Cleveland Clinic has on our website some really good materials to help to guide businesses and individuals as to how to get back to work and how to open up with, just some general principles. And these are the same things that we've heard all along. All employees and people that are going there should be hand washing, whether it's with soap and water or, the hand sanitizer. Social distancing, it's 6 feet, and really limiting any, closer exposures, and limiting the time of exposure is very important. The cloth masks that, we're seeing, those are actually extremely important, and, encouraging everybody to use those in their interactions outside of their home is ideal. So those are the things that, people can start off with. Also, determining, those business as a business, you certainly want to, show your customers that you're taking these things very seriously, and,
Absolutely.
tell them what you're doing to decrease both the risk of your employees as well as the risks of your customers.
Great. That makes a lot of sense. And I will link in the description of the video below, everyone, the website, so that you can get that information if you're looking for it.
Thank you.
Wonderful. Awesome. Now, since the pandemic started, Dr. Babiuch, what does a typical day at work look like for you?
So that's been changing by the day also. So really early in the pandemic, we stopped seeing patients face-to-face in the office unless it was absolutely necessary. And, this really pushed us and me to switch to virtual visits, doing things at least initially.
Sorry about my dog there, everyone.
You're getting a delivery. That's perfect. So switched into doing things by FaceTime, Google Duo, even just telephonically to be able to deliver that care. So that's what we did initially. But since then, and, over the last few weeks in opening up, my day now is a mix of both. I see patients face to face. I do a lot of that virtual and telephone care. I work very closely with my nurses when, patients call in to help to solve those needs. So it's been a really cool learning experience, I think, for us as to how to do things virtually. Um, I would say it's been interesting. I've gotten to see a lot of inpatients home, like yours here. Some people do their visits from bed. Some people, put on their makeup and everything, and some don't. Exactly. I have had to stop a few patients while they're driving on their virtual visit and say, "Hey, wait a second, we can't be doing this." So it's been interesting, but I think it's also been fun. It's been, sometimes even more personal, and allows me to interact and get to know people a little bit better.
And that's what it's all about, relationships. Being able to take care of people and get to know them, and it's helps with the sense of community, and I think Cleveland Clinic does a good job of that. Now, what can we do this summer to be safe if we're going out to the beach, if we're going camping, if we're doing things that we're trying to have a sense of normalcy? What can we do to be safe this summer with COVID still being out there?
Yeah, so I mean, I guess I would say the first and foremost thing is to be smart about what you're doing and always be a little bit skeptical and really think about it. We're always weighing, the risks of going out and doing things, and getting COVID with, the fact that we've really been, pent up in our homes and wanting to get out and do things. So I think, what I would say is you have to kind of assess what the risk is of being exposed to COVID, both in the settings that you're thinking about doing, as well as the people that you're thinking about being around. So what we're saying is really consider, time, space, and people. So what we mean by time is really kind of thinking about how much time you're going to be in a given place or spending at a given activity. Certainly the less amount of time that you're doing those things will decrease your risk of exposure. Then is thinking about the space. If you're going out for a walk at a park, that's significantly different than if you're going to a rally or a large gathering, or something where there's going to be a lot of people in close proximity. Obviously the risks are very different between the two. And then the last one is people. So if you are going somewhere with people that you don't know how they've been taking care of themselves and decreasing their exposures, that would put you at higher risk, as opposed to, going to see a family member who has been, limiting their exposure both at home and at work, and is relatively safe. And also, people need to respect you. And if they're not feeling well, saying, "Hey, I'm not feeling well, you can't come over, I can't come over, we can't see each other until, we figure out what's going on." Those are the types of things that are really important to thinking about what you're doing for the summer. We typically, and this is on, our Cleveland Clinic website as well, examples of things and the risks that go along with them, and I'm just going to give a few. So going to get a haircut, so at a salon or barber shop. So that's kind of low to medium risk.
Okay.
You've got to make sure where you're going is following proper guidelines. People are wearing face masks, there's proper spacing, so on and so forth. Going to the doctor to have a procedure done, or just coming to the office, as far as the Cleveland Clinic, we'd say that is low risk. We're doing a really in-depth job to decrease that risk as much as possible. Going to the gym to exercise, rarely do you hear this out of a doctor, but that's high risk and probably would consider not doing it. Certainly you're breathing heavy, people are sweating, it's tough to clean some of the things. So, if you're going to be doing that, you have to understand of, what that risk is. Going to large gatherings, wedding, barbecue, things like that, that can be variable in terms of risk. It could be medium to high risk. So certainly thinking about that. The other big things that we talk about are obviously going to restaurants. That could be low risk if you're out, in, eating outside and there's lots of distancing. versus high risk if you're inside and the business hasn't spaced things out. So hopefully those are some examples as to how you can think about differences in your risk when you're going out and doing things.
Thanks. Now, on a different note, what can Main Street Wellington here in the community, what can we do to help Cleveland Clinic during this time?
So I guess I wouldn't say directly helping Cleveland Clinic. I would say helping the community and the community health to make our job easier. So I think it really is for all of the businesses in the community, in Main Street, really focusing on following these proper guidelines, taking this very seriously, and really modeling, as I would say, modeling the behaviors that we want to see in our community. So having employees wear masks, paying attention to social distancing. I think people see, those businesses that, in Main Street Wellington doing those things, that can be quite powerful. And hopefully that trickles down to other businesses and other locations, and they can be a leader in, keeping the community healthy and safe.
Without a doubt. How can our viewers stay connected with you and the clinic online?
So obviously, through our website is one way. There's a wealth of resources on COVID-19, as well as, certain other general health things. The people that are patients here at the Cleveland Clinic in the area, as well as Wellington, obviously have their contacts, in terms of the phone numbers and, our MyChart, which is their patient portal to interact with us. We'd encourage them to do so if they have any needs. And then people that are interested in becoming patients certainly can call, and our team's ready here to assist with that, whether that's a long-term relationship or something that is, around to help, an acute illness. The other thing I would say, the Cleveland Clinic has our Express Care Online, which is, a virtual way to interact with the doctor, whether that's for acute or chronic care. And that has been widely used and very successful here recently.
And my wife and I both have used that as early as this January. So definitely like that app. It's a good way to get connected with a caregiver.
Yeah, glad to hear it.
Awesome. Now, in response to the pandemic, and on a personal note, what's one piece of advice that you could give our viewers?
The piece of advice that I've been giving everybody is to take this seriously. That is the best thing that you can do, is to help to keep your family and loved ones and community safe. As things are opening up, we certainly have a risk to see increases in cases. And we are in fact seeing that. And the point that I want to drive home is we're seeing that increased risk, or that increased number of cases here in the last week or so. And it's been in, younger population, those 18 to 40. And while that group doesn't have illness that, is as severe as older patients, it's still significant. And the risk is, if it increases in that group, those elderly people, it's going to follow in the future, because it will spread. It'll spread to, older loved ones, older family members, friends, and that's a big issue. So I guess what I would say is to take it seriously, wear your mask, do your social distancing. You may not agree with it completely, but it only takes one slip up to get a loved one sick and have them end up in the hospital to say, wow, I really shouldn't have done that.
Yeah, I definitely get where you're coming from there. That's good advice. And aside from the advice you can give us, what has this situation, this pandemic, taught you about yourself? Maybe something that you never thought of before this happened.
That's a good question. and I haven't had whole lot of time to reflect on that because we've been so darn busy. Um, so I would say, I think, the first thing that comes to mind is just, enjoying what I do in terms of medicine and being able to do things differently. So I think, just off the top of my head, I would say it's, just showing, my personal flexibility and being able to respond to different things in different ways and really determine what are the best ways to meet the needs of patients, my family, and myself. So being able to do things very differently, doing visits virtually. I was also for the Cleveland Clinic running our home monitoring program for people with COVID. So learning how to, reach out to over 3,000 patients to help to make sure that they're staying healthy. And then just within, my community and my family is, how are we going to, change things to, keep ourselves healthy?
Great. And I would say that that's a pretty good lesson that you've learned, and it's really probably shown that you can handle a lot more than you ever thought you'd ever have to in a short amount of time.
I think a lot of people are doing the same. So,
Yeah.
and
we're all being challenged in this world right now, and it's showing our true mettle, so to speak.
yeah, and I guess I would say, also kind of looking at things at a community level, so, I think we can, kind of get really caught up in our own lives sometimes and what we're doing. But this pandemic really says, we need to think bigger than that.
Yeah.
So hopefully, it's changed some people's approach.
Without a doubt. So one final question I have for you, and it's a Wellington focused question. There's a lot of great places to eat here in town. What's your favorite place to eat or favorite thing to eat here in Wellington?
I haven't found any that I don't like yet. So, we tend to get lunch from, businesses around, which has been great. A few to call out in particular that we like to get. Certainly, dog tracks, we do well there. Bread and Brew a lot. I love the spicy chicken sandwich from the Eagles. End up getting that quite a bit. So, we try to all kinds of food from around, and hasn't disappointed. So thanks to those local restaurants that keep us fed. So.
And at your other location, where you spend a lot of time out in that community, what is your favorite place to eat? Just for us Wellingtonians to go and try something new.
So so up in Lorraine, that area. So don't do eating out as much as I do down here. But I will say, in particular, we had a local business up until about 6 months ago that had a little cafe in our family health center. So it's a little bar restaurant called Huggies in Vermilion. So
Okay.
give a shout out to them. They did a fantastic job for, I think it was around 8 years of serving us some great food. So I still, like to make it then to Vermilion to get some food from them. So, so that's kind of where the one that I would call out in Lorraine.
Okay, perfect. Now, Dr. Babiuch, is there anything else that you'd like to share with our viewers today?
No, I think we've gone through a lot of the important things, regarding the pandemic. What I would say is, during this time, we've been kind of staying in a lot. And one of the really two biggest things that I would say there is, pay attention to how you're feeling, and in particular, mental health. So certainly isolating, changes in our lives and the stress that's going on in our communities, both with COVID and other things, can really get to you. So pay attention to that and know that there are resources available if you're to feel down, depressed, stressed, things like that. And also is, to take some of this time to slow down, pay attention to yourself, your life, your family. That for me has been a rather good outcome of this. I'm not running my kids around to so many, games and other activities that we've been able to spend a lot of time together. So definitely take the time and slow down to do that.
Awesome. Thank you for sharing that. And again, Dr. Babiuch, I want to thank you so much for coming on the show today. Thanks so much for all that you and Cleveland Clinic are doing to support our community and all the communities across Ohio. Also, just thanks for your partnership with us as Main Street Wellington, we work to strengthen the spirit of Wellington. And again, for all of our viewers, everyone watching, please do like, share, and subscribe to the channel. Also, please comment on the video and let us know what you'd like to see on future episodes. Thanks for tuning in to another episode of Afternoons with Anthony, and we will see you next time.